Welcome to the Heart of the Matter, where we deep dive into the world of medicine with leading experts in the field. I'm your host, 𝐬𝐮𝐬𝐫𝐷, and today we have an exceptional episode lined up. We are joined by not one, but two incredible guests, Professor Abdullah Shihab and Dr. Rita Nawar, with decades of experience between them in cardiology, endocrinology, and internal medicine. They have both contributed immensely to the medical field in the UAE. Professor Shihab is a professor of cardiovascular medicine at UAE University. He is also the chief editor of the new Emirates Medical Journal. He's held several prestigious positions, including the vice president of the Gulf Intervention Society and the vice president of the Emirates Cardiac Society. He is a consultant in cardiology and interventional cardiology with extensive 25 years experience in internal medicine, cardiology, and interventional cardiology. As for Dr. Rita Nawar, she is a leading endocrinologist with a focus on diabetes, obesity, and metabolic diseases, with over 16 years of experience. She has contributed to numerous studies and clinical practice recommendations in obesity, and she's currently practicing at American Academy of Cosmetic Surgery Hospital. She is also a member of the Obesity Society, in addition to other international societies. Today, we're going to explore the obesity causes and its complications, discuss the science behind obesity and different management pathways, and look at how multidisciplinary approaches can improve patient outcomes. So, let's get started. So, Professor and Doctor, thank you guys for being here. My first question I'm going to ask you is, can you explain why society, or now obesity, as we call obesity, is increasingly being known as a disease rather than just a lifestyle issue? So, can you try to touch upon that? Is it really a disease, obesity, and why is there a confusion in that image in the public perception?
Thank you very much for having us here. This comes from the evidence-based, again, from the societies like American Heart Association, Obesity Society, and lots of international societies. When it comes to the definition of obesity, although they give it based on the body mass index above 30, and then when they looked at all the landmark studies, they found the association between the obesity and the diseases like cardiac disease, stroke, hypertension, diabetes, dyslipidemia. So that's why it's called disease. And it's come as interactions of many things: genetics, environmental, metabolic, and mental, of course. So having that put more emphasis on it as a disease rather than just a lifestyle. If it's a lifestyle, that means it's a personal problem. But if it's a disease, then it's everyone's problem. Need to be dealt with it as a practical way.
Dr. Rita, do you agree with what you're saying?
First of all, thank you, 𝐬𝐻, for having me and for allowing me to be part of this podcast and discussion about obesity. And this is a topic very dear to my heart. Now, in addition to what Dr. Abdullah was mentioning, we know now that obesity is not a result of moving less and eating more. And in fact, there has been a lot of research all throughout the years. And we know that there are a lot of elements and factors leading to the disease of obesity, because I do consider it as obese as many societies. Why?
You do consider it as a disease?
There are a lot of genes that predispose the person to have elevated weight, and over 100, 140 genes. And those genes will confer a change, a dysregulation in the biology and physiology of the appetite and energy regulation. And this interplay is between the brain and the organs, meaning pancreas, meaning fat cells, meaning stomach, intestines, pancreas, I mentioned it, and liver. And this dysregulated appetite and fullness signaling will lead to abnormality in utilization of the food and accumulation of the excess energy of food that we're eating into fats. So elevated fat. Now, this is exacerbated, of course, by an environment that is not very much obesity friendly or weight friendly. Why? Because widely available food, palatable food. We enjoy eating. It's easily accessible to people. And people who have this dysregulated signaling will have a problem in metabolizing that type of food and accumulating it as fat. In addition to that, there is stress. We all live in a stressful, work, profession, and all that will increase some hormones in the body. And those hormones, like cortisol, for example, will lead to predispose us more, or for people who are more predisposed to gain more weight. And this will lead to more health complications, as Dr. Abdullah was mentioning. And this is chronic. This is not something that we can cure. This is something that we can help in controlling.
The most significant complications from obesity, what are they? And what's, can you rank them? Is it what's more prevalent? What's not prevalent? I would like to know.
In fact, there are over 200 complications related to obesity, 286, and more to come. Maybe we will discover more.
Oh my God.
From the metabolic complications, be it type 2 diabetes, prediabetes, dyslipidemia,
heart
liver.
disease, of course, yeah.
Oh, absolutely, but I was leaving it to
till the end, okay.
Yes. Fatty liver, leading at times even to liver cirrhosis and liver transplant for some patients. From fertility, polycystic ovaries in ladies, even mechanical complications, cancers, many types of cancers, especially female cancers, uterine cancers, colorectal cancer, esophageal cancer can be correlated with excess body fat. Mechanical complications, I was mentioning asthma, sleep apnea, even osteoarthritis, back pain, even physical functioning, just your day-to-day physical activity, tying your shoelaces, getting a seat on the plane without having to have an extension for the seat belt.
Absolutely.
Definitely.
Yeah. And I feel that too. Even I like in the simplest terms, when I feel bloated, my movement feels slower, and then when I'm not bloated, I feel much more energetic. Yeah. So imagine that on a larger scale. So that's
absolutely.
So a simple way, Isa, what Dr. says is, if you take it like somebody's, obese and having associated with the high blood pressure, associated with the abnormal lipids, associated with diabetes. So basically you are at any time you will get cardiac problems. Like what? Like heart attack, you get a stroke. So when we say disease, we really meant because, having obesity, it just make you less active.
Okay, now I want to ask about managing obesity. So, and how that contributes to improving cardiometabolic risk factors. So I know we've touched upon problems with heart. I want to focus on that. How basically managing obesity, it improves cardiometabolic risk factors.
Nowadays we know that we treat obesity not to lose weight. In fact, we treat obesity to gain health. And I always tell my patients, weight for obesity is same as fever for infection. You don't treat the fever just to bring the fever down. You need to treat the infection and the disease as such. So we do treat weight in order to improve on metabolic complications and all the complications that we were just discussing. And we know that losing 5% of body weight can improve a little bit on glucose. Losing 10% and 15% of body weight can lead to diabetes remission, improvement of the HbA1c by at least 0.43%, pre-diabetes remission by 80%, decrease waist circumference by 14.4 centimeters. And we know that this means that your liver do not have any more fat, your health is better internally, and so on and so forth.
So it directly affects the numbers, numbers that matter.
Absolutely.
And Professor?
Yeah, Doctora mentioned about diabetes, and diabetes plus dyslipidemia, which is high cholesterol and high blood pressure. These are the major risk factors for having heart attack and a stroke. So imagine by reducing the weight or tackling obesity, you are significantly reducing the LDL, which is a corner, the main entity for the high cholesterol, which lead to the heart attack. You reduce that significantly based on evidence, based on randomized clinical trial. The same apply to triglyceride, which is another bad lipid, we can call it. Same apply to the blood pressure. You're reducing it, by 5.7 millimercury. And so that's these things. If you do it through the obesity, which is you are preventing major events like heart attack and stroke. I think is
so step by step. Let's go first. Okay, first of all, I have this disease, or I'm suffering through obesity and because of disease. So who should I call the first one?
You have to go to your healthcare provider.
Healthcare provider.
The family physician, family doctor, or your primary care physician. You always seek medical help because it is a disease and has to be treated as such. And the approach has to be holistic. You do not go to the neighbor. You do not go to the pharmacist. You go to a medical professional to be able to be properly and professionally assessed.
Okay, great. So let's talk about the assessment now. So I because this is I like to break things down. So you said the consultation takes a long time.
Absolutely.
So walk me through it. Why? And would that be discouraging for me as a patient to see? Oh my God, it's going to take me such a long time to even get help. Isn't this discouraging?
At all. It's a long conversation. In fact, we start, of course, if the patient is coming for a different reason, and we notice that he has elevated body weight and he has health complications that are related to it, and maybe he did not mention weight, we need to ask his permission. And this is, in fact, the 5A frame that is recommended by the Canadian Obesity Society.
The 5A.
Through their guidelines, exactly. So we start with the ask. Now, if the patient is coming specifically for weight management, then we will sit and we need to assess. And this is the second
So ask and then assess?
Exactly. And the assessment, this is what takes long because we need to assess everything in the patient on the personal level, the health level, the family background, the educational background, his work, his mental status, as Dr. Abdullah was mentioning, his
social life,
his habit, his physical activity, his medications, what other health conditions he has. And we need, of course, to examine and do a very proper physical exam. At times, we might need to check for some laboratory if we think that the patient might have diabetes, prediabetes, fatty liver, and many times also we check for some hormones to see if there is any root.
And these 5 A's Dr. mentioned, I think, which is...
so we have ask, we have assess,
and we
have
the
advise.
And
And then the last two?
And the last two, of course,
agree and assist.
Agree and assist, exactly.
So in terms of agree, I think this is I think the practical aspects, because you're agreeing with the patient what we going to be our goal. And again, this should be like a smart approach, like should be specific.
Agree on a treatment, agree
on what's our goal. Yeah, and then of course assist. You need this person needs to help them. Okay, you need to if they have any challenges, they say, doctor, I cannot do this because from economy point of view, I cannot do it. Because
I've never exercised, for example.
I don't sleep. So you need to look at every aspect. So to help the patient. Otherwise, your advice will be, which was I think the corner of everything, will be useless. If you don't base it on patients' life and preference and to help them that way. Yeah.
So great. I love these 5 A's. I think let's focus more on the third one, which is the advice.
Yeah.
So I want to know more. Can you like, what kind of advice, like based on your personal experience, that's helped a lot, that's literally treated or managed these complications in obesity? For
me, once I know their the history, I think is important. If the patient are inactive, I ask them to be active. To be active, how to be active. There are many ways. All these are based on the guidelines. It's not just Abdullah Shihab or Dr. Rita's opinion. No, it's based on the guidelines supported by randomized clinical trials. Is to walk, to be active. 30 minutes per day. Per week, most of the days. Use the stair. Why you using the lift? Use a stair. Park your car far away from the where you want to shop.
Absolutely. In fact, definitely we do advise our patients about what are the complications of obesity.
Basically scaring them.
Not scaring, but stating facts.
Yes. Showing them the risks of it. Yeah.
Absolutely. Advising a patient or a person with elevated body weight to change lifestyle, as you mentioned, is easier said than done. But this is still the cornerstone of any obesity management. It's still very important. And advising it has to be, as Dr. Abdullah was mentioning, patient-centered, depending on his habits or her habits, depending on the social background, depending on the for example, people who work night shift versus people who work a day shift. They have people with night shift, they have more resistant body. They cannot lose easily. The eating habits are different. So we tailor those advice depending on patient by patient, but also this advice to be able to make it work long term, because we said it has to be long term. It has to be all their life.
Exactly, because
it has to be supported. Yes.
Yeah, and I think the reason why you said that because I've seen people who lose weight and then gain, lose and gain, lose and gain. It's like a cycle.
So what's the missing thing in that scenario, Doctor? I think is the commitment and consistency. I think this is important towards.
Absolutely, yes. I would like to add something because, as you said, lifestyle changes are not easy. And yes, they do need commitment and responsibility from the patient, but also they do need help from the healthcare provider. And the help will be by providing the support system to the patient, support system through counseling, behavioral therapy, and also presence of some pharmacotherapy that can help, and those are available also in the market, but those are prescription medications, and the doctor need to choose who is the patient, what medication, until when, how to monitor the patient. Those are available. Also, there is the possibility of bariatric surgery, which is a support for the lifestyle change, because
it's not instead exactly. Yeah, amazing. Okay, well, I want to end this with one note because we talked about advice, we talked about lifestyle. I want from Professor and from Doctora, I want you both to give an advice for the listeners who maybe know or maybe they are suffering from obesity. What's your golden piece of advice? Your first action plan?
I would tell them weight, obesity is not is not your responsibility to take care of it. It's in fact it has to be a approach as a disease, as a chronic disease, same as hypertension, as dyslipidemia. You go to the specialist to seek care. So don't take the responsibility of dealing with it alone the wrong way. Go to the healthcare provider, get medical advice, get good assessment, good help, and come back for follow-up to the healthcare provider who would know how to assess you, how to help you with any complications, how to address other health issues related to obesity, and guide you throughout your journey, because it is a journey.
So the follow-ups, you said the follow-ups are important.
Very important.
Great advice. Professor.
Yeah, I concur what exactly Rita said. I just get the information from right source.
What are the right sources? Can you give me examples?
Right sources are the medical societies in the country. And there are registered doctors. And then what I say, anytime you hear anything in the media, review that person's, even if it says professor there, is he a professor? Is he practicing medicine? Otherwise, don't take it, because there are lots of false ideas and opinions about the obesity.
Doctor, Professor, thank you so much for being with us today at this podcast. It was an absolute pleasure and honor. I hope the listeners who listened took your advice, took your assessment, and hopefully we'll see people at least get inspired to change their lifestyle because of this episode. Thank you so much for being here, and I wish you all the best and hope to see you again.
Pleasure is ours. Thank you very much.
Thank you.
This episode was sponsored by Novo Nordisk to help us understand more about obesity. Since we are approaching the end of the episode, Novo Nordisk has created an online HCP locator website to support patients living with obesity to locate their nearest physician according to the specialty to discuss your weight. And I encourage all healthcare professionals to have open conversations with patients living with obesity proactively. That's all for today's episode of The Heart of the Matter. Thank you for watching and stay tuned for more episodes with leading experts. Don't forget to like, share, and subscribe.